Hello friends, today we will discuss about plasma proteins. It's a very important topic under the subject physiology as well as subject biochemistry in the first year of MBBS. Many a times a question about plasma proteins, describe the functions of the plasma proteins, what is plasmapheresis, how it is separated. In the theory exams of MBBS, these questions are repeated questions as far as first MBBS students are concerned. Okay. So we'll try to make this topic very briefly and discuss it very briefly because it's a very vast topic. In between, we'll try to add some clinical aspects also. So as you know, plasma proteins basically are the proteins which are present in the plasma, right? So about 100 such proteins have been identified till date, but the most important or the major plasma proteins are albumin, globulin, and fibrinogen. Okay, so total normal value of the total plasma proteins is, on an average, it is around 6 to 8 grams per deciliter of the blood. Okay, it is the normal value, total number of the plasma protein, that is, or if we convert it into liters, so in 1 liter it will be around 60 to 80 grams in 1 liter. In 1 deciliter, it is 100 ml, it is around 6 to 8 grams. So if we try to find out the individual plasma proteins, these major plasma proteins, so albumin is the most abundant plasma protein, which will constitute around 60% of the total plasma protein. So the normal value of albumin is around 3.5 to 5 grams per deciliter. Okay, then globulins, it is around 2.5 to 3.5 grams per deciliter, whereas fibrinogen, it is around 200 to 400 milligram. Okay, please concentrate on the units here. It's 200 to 400 milligram per deciliter. In terms of gram, it will be around 0.2 to 0.4, that is, on an average, it is around 0.3 grams per deciliter. Okay, these are the normal values, total value as well as the normal values of the individual plasma proteins. Okay, now how they are separated? So these plasma proteins are separated by various techniques. So the most important technique is by electrophoresis, by either paper or gel electrophoresis. So I won't go in detail about the technique of the electrophoresis, but the pattern, how we look, how we get in a normal person, in a normal blood, so it will be like this. This is albumin. Then there are 4 subtypes of the globulins: alpha 1, alpha 2, beta, and gamma. Okay, so let me label here. So this is the electrophoretic pattern of the normal plasma proteins. Albumin, this band denotes the albumin, and here it is alpha 1 globulin, alpha 2 globulin, beta globulin, alpha 2 globulin, beta globulin. These are the different bands of the globulin molecules. Okay, so alpha 1, alpha 2, beta, and finally the gamma globulin. Okay, gamma globulin. So in this electrophoretic pattern, you can see there is no fibrinogen. We are just seeing the albumin and globulin, because majority time it is the serum sample. Okay, so you know the difference between serum and the plasma. Serum is plasma minus clotting factors, Okay, so fibrinogen is a clotting factor, or simply serum is plasma minus fibrinogen. So here you can see albumin, globulin, and fibrinogen. So serum contains albumin and globulin, fibrinogen is deducted. Okay, if we consider plasma is serum plus fibrinogen is plasma. Okay, that is the clotting factors. So that's why even this albumin and globulin, sometimes they are termed as serum albumin and serum globulin, not the serum fibrinogen. Okay, fibrinogen, if we take the plasma sample in the electrophoresis, then we may get a fibrinogen band also here. Okay, if we take a plasma sample, then even we can get a band here of fibrinogen, but generally a serum sample will get albumin and globulin sample only. Okay, now let us discuss the most important thing, functions of the plasma proteins. So before that, a few words about the synthesis. So these plasma proteins, albumin, globulin and fibrinogen, basically they are produced in the liver in the normal adults. In embryonic life, it is synthesized in the yolk sac or the mesenchymal cells. So the except for gamma globulin, that is immunoglobulins, okay, all the plasma protein they are synthesized in the liver. So we will discuss the functions of individual plasma proteins. Okay, so let us start with the albumin. So albumin is the most commonest, that is the maximum plasma proteins, that is it will occupy the 60% of the total plasma protein. So it is having around molecular weight of around 69,000 and it is synthesized in the liver. So the important functions of the albumin is it will help in maintaining the colloidal osmotic pressure, maintaining the osmotic pressure of the blood, osmotic pressure of the blood. Now what does it mean? Okay, so let me explain these things. Okay, you know, the consider any cell, and the transport of the substances from the circulation and this cell will take place at the level of the capillaries. You know the circulatory pattern, right? The arteries, then smaller arteries, then arterioles. The arterioles will divide into capillaries. They will divide into capillaries. Okay, so consider this as a capillary, what I am drawing right now, and this is the arterial end. Before that there are arterioles. Arterial will divide into capillaries. Now these capillaries again will continuous as the venous system, that is the venous end of the capillaries. So ultimately from here small veins, that is the venules and small veins and veins, ultimately superior and inferior vena cava into the right side of the heart. So this will drain into the right side of the heart and the arterial system from the left side of the heart, right? So this is a basic capillary. This is an arterial end, this is the venous end. So in the capillaries there is blood, that is the plasma will be present, right? Plasma, RBCs, WBCs and platelet, that is basically the blood. Now this blood it may cross this capillary membrane and come out into the interstitium, and can come out into the interstitium, right? Interstitium, and the force which will help for this blood to come out from this capillary bed into the interstitial region, okay, that is outside this cells and outside this capillary membrane. So this force is known as hydrostatic pressure. Okay, hydrostatic pressure, this force. So hydrostatic pressure basically it is nothing but the blood pressure, the pressure which will help in transport of this fluid part of the blood, that is the plasma, to outside the capillaries, okay, in the interstitium. Now this hydrostatic pressure, that is the blood pressure at the arterial end of the capillaries, it is roughly around 35 millimeter of mercury. You know the normal blood pressure, systolic blood pressure is around 120 millimeter of mercury and diastolic is around 80 millimeter of mercury. That normal blood pressure is basically what we record is the arterial blood pressure. Okay, the same blood pressure when we record at the level of the capillaries, then it will be around 35 millimeter of mercury, right? So this 35 millimeter of mercury is basically blood pressure or the hydrostatic pressure, which will help in transport of the fluid in this direction. Now consider plasma proteins. Plasma proteins, where they are present of course in the blood, in the capillaries here. Now these plasma proteins, and mainly majority of the time albumin, so they also exert some pressure, and the pressure exerted by the plasma proteins, they are known as colloidal osmotic pressure or oncotic pressure. Both are same. Okay, oncotic pressure, or even simply if we mention osmotic pressure, okay, that is exerted by the proteins, plasma proteins, albumin, and they will exert a pressure of around 25 millimeter of mercury. So what this pressure will do is they will try to or tend to prevent the fluid to go outside. That is, they will act as a suction force by which the fluid is dragged or remain inside the capillaries. Okay, so it will prevent the fluid to flow to cross this capillary membrane and come into the interstitium. So these are opposing forces, this hydrostatic pressure and this oncotic pressure or colloidal osmotic pressure, they are opposing forces, and these forces are termed as Starling forces. Okay, Starling forces. So Starling forces, that is the hydrostatic pressure and this oncotic pressure, they are opposite, they are in opposite direction. So here you can see at the arterial end, the hydrostatic pressure is 35 and the oncotic pressure which is exerted by the albumin is 25 millimeter. So it is more, hydrostatic pressure is more, so the fluid will tend to come outside these capillaries into the interstitium, and through this it may cross to the cell membrane, that is the important substances like oxygen and all, or the nutrients, it will go to the cell. So at the arterial end, the hydrostatic pressure is more and oncotic pressure is less, right? So the fluid will tend to come outside. But at the venous end, the hydrostatic pressure is 15 millimeter. Instead of 35 millimeter, here the hydrostatic pressure is 15 millimeter. That is again the blood pressure here. Hydrostatic pressure, venous end, the blood pressure will be less. Okay, so 15 millimeter. But the oncotic pressure or the pressure exerted by the plasma protein, especially the albumin, will remain the same, that is 25 millimeter. Now you can see the difference here. Here the oncotic pressure is more, that is the suction force, it is more. The oncotic pressure, the suction force, it is more as compared to the hydrostatic pressure. Okay, it is less. So they are opposite direction. So because the more suction force exerted by the plasma protein, so the more fluid will tend to enter here at the venous end. The fluid which has come out, or even the fluids here in the interstitium after the metabolism of the cells and all, it will be accumulating here in the interstitium, and that will be sucked out or by this suction force of the oncotic pressure ultimately. So arterial end it will move here and venous end it will move here. So this is the in normal persons with the normal plasma protein, especially the albumin, right? So that's why the fluid will not get accumulated here. Fluid whichever coming here in the interstitium will go back in the venous end, from the arterial end to venous end. This is the basic mechanism, right? But in deficiency of plasma protein, especially albumin, okay, for example liver failure, liver, as I said you, it is the site where the proteins, plasma proteins are synthesized. So wherever there is a decreased production of the plasma proteins like cirrhosis of the liver, or there is excess excretion of the plasma proteins like nephrotic syndrome, in the urine plasma proteins, albumins are excreted in nephrotic syndrome, okay, or malnutrition where there is a deficiency of the proteins, dietary deficiency. So ultimately, due to any reason, if there is a deficiency of the proteins, now the Starling forces are affected and there is more accumulation of the fluid in the interstitium, because this oncotic pressure or the colloidal osmotic pressure is reduced, and this term, that is the accumulation of the fluid in the interstitium, generally it is known as edema. Okay, we'll discuss about this topic in detail in any other video. Right now just remember, the deficiency of this, edema may occur. Again, the different types of edema, there is a mechanism of edema, we'll discuss later. So there are so many causes. One such cause is due to the deficiency of the albumin. So the most important or the first function of the albumin, what we should remember is it will help in maintaining the osmotic pressure of the blood. So deficiency of the albumin will lead to edema, that is accumulation of the fluid in the interstitium. Edema can also be the accumulation of the fluid inside the cell. Okay, that is a different thing, but in general what we use this term edema is for the accumulation of the fluid in the interstitial fluid. Okay, now second important function is albumin helps in transport of various substances, transport function. Okay, so albumin will help in transport of the phospholipids. Okay, phospholipids, then fatty acids or lipoproteins also, then bilirubin, then certain metals like copper or calcium are transported through the albumin. Certain hormones like thyroxine, that is the thyroid hormone, or even the steroid hormones like cortisol. So these hormones are also transported by the albumin. Okay, there is one more fraction of the albumin known as pre-albumin. So the pre-albumin will transport the thyroid hormone. It also transport the thyroid hormones, and that pre-albumin which transport the thyroid hormone, it is known as transthyretin. Okay, so thyroid hormones are transported by the albumin as well as pre-albumin. Okay, also by the globulin. Which fraction of the globulin we'll discuss later. Right now just remember this. So albumin has a very important role in the transport mechanism. Okay, it will transport so many important, and also certain drugs. Okay, albumin will transport certain drugs like aspirin, salicylates, and phenytoin. Okay, then third important function of the albumin is it will act or help in the nutrition of various tissues. So it has a nutritive function. Okay, so since albumin is a source of essential fatty acid, that is it is basically protein made up of fatty acids, and albumin is made up of most of the amino acids are essential amino acids, sorry, not fatty acids, essential amino acids. So essential amino acids are necessary for the protein building. So it will act as a source for providing the essential amino acids. So it will serve as a nutritive functions to different tissues. So albumin also helps in, it will act as a buffer, okay, for acid base balance and all. However, the bicarbonate buffer is much stronger than this. So but albumin has a role in maintaining this acid base balance and acting as a buffer. So the four important functions of the albumin what we have discussed is it maintain the osmotic pressure of the blood, it has a transport function, then it will help in nutrition, it will act as a buffer. Now let us discuss the globulins. Different globulins. So as we have discussed, there are different bands or the different subtypes of the globulins. That is alpha 1 globulin, alpha 2 globulin, beta globulin, and gamma globulin. Okay, however beta is also now beta 1 and beta 2, but right now we'll stick to just beta globulins. Now we'll discuss what are the proteins and what are the functions of this various globulins. So first we'll discuss about the alpha globulin. Okay, alpha globulin. Now various proteins which will come, plasma proteins which will come under alpha globulin are alpha 1 antitrypsin. So it is a alpha 1 globulin. So what is its role is it will inhibit one enzyme or protein that is known as trypsin. Okay, basically this acts as an enzyme which will break or the proteins, that is it acts as a proteases. So alpha 1 antitrypsin inhibits the trypsin. So when it inhibits the trypsin, so it will indirectly helping the or it will preventing the breakage of the proteins. Okay, so basically the proteins having these serine amino acids, okay, it will help in preventing the breakdown. Now clinical conditions where we can see such the role of alpha 1 antitrypsin is in the respiratory system. One clinical condition, it is known as emphysema. Okay, so basically what happens here is in the lungs there is elastic tissue. This elastic tissue is destroyed or eaten up by chemicals or the enzymes known as elastase. Now alpha 1 antitrypsin will inhibit this elastase generally and prevent the destruction of the elastic tissue. But in the congenital or hereditary deficiency of alpha 1 antitrypsin, what will happen is there is no inhibition of the elastase, and this elastase enzyme will break down the elastic tissue, and what will happen is the lung size, okay, the size of the lungs will dimensions will increase, and there is a more accumulation of the air inside because the elasticity is reduced. So that this is a disease condition. We'll discuss in detail about the emphysema in any other lecture. Right now remember alpha 1 antitrypsin, which is alpha 1 globulin, okay, will deficiency of this will lead to emphysema. Similarly there is one more disease, alpha 1 antitrypsin liver disease. Okay, again that is also having the same mechanism. Now second important alpha 1 globulin is alpha 1 lipoproteins. alpha 1 lipoprotein, it is also known as HDL, that is the high density lipoprotein. It is also termed as good cholesterol. So basically this alpha 1 lipoprotein, which is a alpha 1 globulin, will help in transport of cholesterol, okay, reverse cholesterol, reverse transport of the cholesterol, that is from the tissues to the liver, okay, that's why it is termed as good cholesterol. Then alpha 1 fetoprotein, that is basically a fetal protein, it is also a subtype of alpha 1 globulin. What we are discussing, all these new chemicals are the alpha 1 globulin. Alpha 1 globulin is a globulin. Globulin is a plasma protein. So this ultimately, these all are plasma proteins. So these plasma proteins will serve in transport mechanisms also, this alpha 1 globulins. For example, orosomucoid. So again, this orosomucoid, this will help in the transport of progesterone hormone. Similarly, we have retinol binding protein. Retinol binding protein that will help in the transport of the retinol, that is the vitamin A. Then we have the thyroid binding protein. Okay, so thyroid hormones are transported by the pre-albumin and albumin. We have already discussed. There is one more, thyroxine binding protein. This is alpha 1 globulin. So globulin, that is plasma protein, helps in transport of the thyroid hormones, okay, for thyroid hormones. Similarly, we have transcortin. It will help in transport of steroid hormones like cortisol. Okay, so these are the alpha 1 globulins. Now coming to the second subtype of globulin. Before that, what is the normal value of this alpha 1 globulin? It is around 0.3 to 0.5 grams per deciliter. Okay, total globulins is around 2.5 to 3.5 grams per deciliter. Out of that, alpha 1 globulin is around 0.3 to 0.5 gram per deciliter, and these are the various alpha 1 globulins, okay, and majority of them are helpful in transport of various substances. So functions of this alpha 1 globulins are transport, and it will act as an anti-proteases, okay, like antitrypsin and all, okay, and basically other things are transport. Then coming to the second subtype of globulin, that is alpha 2 globulin. Alpha 2 globulin, the normal value of alpha 2 globulin ranges from 0.4 to 0.8 grams per deciliter. Okay, this is the normal value. Now, what are the various plasma protein which are the alpha 2 globulins? So important one is alpha 2 macroglobulin. Again, it is an anti-protease, that is, it will inhibit the protease enzymes that will help in breakdown of the proteins. So ultimately, it will preserve the proteins by inhibiting the protease enzymes. Then second one, there are again, it will help in transport of various substances. For example, haptoglobulin helps in the transport of the hemoglobin. So generally, after the hemolysis, when the RBCs are break down and the hemoglobin from inside the RBCs are coming out into the circulation, and it may try to excrete through the urine, that is prevented by this alpha 2 globulin. That is, it will bind to this hemoglobin molecule and prevent its loss. That is, the hemoglobin molecule plus this alpha 2 globulin, this is known as haptoglobulin. This is a alpha 2 globulin. Then similarly, we have very important one more alpha 2 globulin, ceruloplasmin. Again, this alpha 2 globulin helps in transport of the copper, that is copper binding protein. So generally, deficiency of this particular protein, ceruloplasmin, will lead to the excess of the copper in the blood, and it leads to one clinical condition known as Wilson's disease. We'll discuss about this Wilson's disease in some other video, detail about this hepatolenticular degeneration or Wilson's disease. Okay, it is related to the copper metabolism, where ceruloplasmin deficiency will lead to Wilson's disease. That is, it will help in binding the copper and transport of the copper. Then we have similarly for transporting the vitamin B12, transcobalamin. or transcobalamin, which will help in transport or binding the vitamin B12. So basically this globulins are helpful in transporting the various substances. For example, alpha 1 globulin is helpful in transporting vitamin A, thyroid hormones and cortisol, and alpha 2 helps in the copper, hemoglobin, vitamin D transport. Okay, and one more alpha 2 globulin very important protein is prothrombin. Prothrombin is helpful in the process of blood clotting. Okay, we'll discuss in detail about this in some other video, blood clotting, under the section of platelets and blood clotting. Okay, so it will help in the process of blood clotting. How exactly, we'll discuss later. Timing right now, remember, prothrombin is the alpha 2 globulin, which will help in blood clotting. Then third important subtype of globulin is beta globulin. So the normal value of the beta globulin is around 0.6 to 1 grams per deciliter. So what are the beta 2 globulins or the beta 2 globulin plasma proteins? So the important one is beta lipoproteins. So beta lipoproteins is also known as LDL or the low density lipoproteins. Okay, so it is opposite to HDL. Okay, and it will help in the transport of the cholesterol from the tissues into the blood. So excess accumulation of these globulins or the beta lipoproteins or the LDL, sometimes it can be dangerous. It will lead to atherosclerosis. Okay, for example, atherosclerosis of the coronary arteries, and it will lead to a myocardial infarction or a heart attack. Similarly, atherosclerosis of this one blood vessels, cerebral blood vessels, that may lead to stroke also. So other beta globulins are transferrin. So it will help in transport. Again, majority, as we are discussing, globulins are helpful in transporting the various substances by binding to it. So transferrin will bind to the iron. Okay, similarly we have a hemopexin. It will help in binding the heme protein. Okay, hemoglobins, heme. Then we have very important plasminogen. Again, it will help in blood clotting. Okay, blood clotting mechanism we'll discuss later. Timing, remember, plasminogen related to the blood clotting mechanisms. Then finally beta 2 microglobulin. Microglobulin, again, it is used for the renal function test, especially the renal tubular test. So these are the beta globulins. So finally gamma globulin. Now the normal value of this gamma globulin is 0.8 to 1.8 milligrams per deciliter. The important gamma globulin is immunoglobulins. Now this is very important. Immunoglobulins helps in maintaining the immunity. Immunoglobulins are basically the antibodies. The important immunoglobulins are IgG, IgA, IgM, IgD, IgE. Okay, these are the immunoglobulins. Basically they are gamma globulins. Okay, they have a role in maintaining the immunity, that is the humoral immunity. We'll discuss about this again in the section immunity. Timing, remember, what we are discussing, the functions of the plasma proteins. We have discussed the functions of albumin. Now the functions of globulin, basically it will help in the transport of various substances, like alpha globulin helps in the transport of so many substances, and it will beta globulin also. Then it is helpful in maintaining the blood clotting. Okay, blood clotting mechanisms, plasminogen and prothrombin help in the blood clotting mechanism. Then gamma globulin help in maintaining the immunity. So the globulins helps in maintaining the immunity, then the blood clotting, then it ultimately will help in maintaining the blood viscosity also, and also it will help in transport mechanism of various substances and the antiprotease like alpha 1 antitrypsin. So these are the globulins. Then finally the fibrinogen, the last plasma protein, important or major plasma protein, fibrinogen. Again, fibrinogen is a clotting factor number 1, and it is helpful in blood clotting. Once again, time won't permit me to describe in detail about the mechanism of the blood clotting, which we are going to discuss in some other video. Timing, remember, fibrinogen, that is a plasma protein. It acts as a clotting factor and helps in the blood clotting. So this is all about the functions of the plasma proteins and the normal values of the plasma proteins. So let me revise what we have discussed today. We have discussed the major plasma proteins, the total plasma proteins normal value, and the normal values of the individual plasma proteins, how they are separated by electrophoresis, how this electrophoresis band looks like. So basically electrophoresis is a technique by which plasma proteins are separated. So there are electrodes, positive and negative electrodes, and the charged ions will try to move in the opposite direction, and albumin has the maximum rate here. So the band will look like this, and globulins are here, alpha 1, alpha 2, beta and gamma globulin. Then we have discussed the functions of the albumin, globulin and fibrinogen, and there are so many applied aspects which we'll discuss later, but one important one is albumin globulin ratio. Okay, globulin ratio, normally it is around 1.7:1, or if in a range 1.2 to 1.8:1. So this albumin globulin ratio, normal ratio, is reversed in certain diseases. For example, liver dysfunction like cirrhosis of the liver or nephrotic syndrome and all, where the albumin production is less and the globulin levels are more. Okay, even in multiple myeloma and all, we'll discuss later about this other clinical aspects like edema, mechanism of edema, hypoproteinemia in some other videos. So if you liked our discussion of plasma proteins, please subscribe our channel and share the link with your friends. Thank you.